The mission of Oregon's Long-Term Care Ombudsman program is to protect individual rights, enhance quality of life, improve care, and promote dignity of residents living in Oregon's licensed long-term care facilities. Today we're talking to Oregon's Long-Term Care Ombudsman program about one of the most common Medicare issues that arises: the skilled nursing facility discharge. One of the most common Medicare issues we deal with is people who believe they are, or a loved one is, being discharged too soon from skilled care at a nursing home, or from a skilled nursing facility before they are ready.
Does Medicare pay for long-term care?
Not exactly. As it turns out, Medicare doesn't pay for long-term care. Medicare pays for a special kind of limited care in nursing homes called skilled care.
What exactly is skilled care?
Skilled care is nursing and therapy care that can only be safely and effectively performed by or under the supervision of professionals or technical personnel. It's health care given when you need skilled nursing or skilled therapy to treat, manage, and observe your condition and evaluate your care. This often occurs after a hospital stay. Medicare-covered services in a skilled nursing facility include, but are not limited to, a semi-private room, meals, skilled nursing care, physical therapy, occupational therapy, speech-language pathology services, medical social services, medications, medical supplies and equipment used in the facility, ambulance transportation to the nearest supplier of needed services that aren't available in the SNF, dietary counseling.
How many days will Medicare cover for a stay in a skilled nursing facility?
Medicare entitles you to skilled care in a nursing home for up to 100 days in a benefit period, so long as you meet Medicare's requirements.
So Medicare will cover the full cost of your skilled nursing home stay for up to 100 days if you need it?
No, not exactly. Days 1 through 20 are entirely covered, but days 20 through 100 require co-insurance, which can also get expensive.
What exactly are the Medicare requirements within skilled care?
The Medicare standard for continued skilled care is that the resident needs the skilled care either to improve or to prevent decline. If the nursing home says they are discharging the resident because he or she has plateaued, the nursing home is applying the wrong standard.
What's the purpose of skilled nursing care under Medicare?
Skilled care is a great thing to help someone who has had a medical problem get back on their feet again. The goal of skilled care is to assist individuals to recover so they can safely return home. To achieve this, the nursing home must work with the individual to develop a personalized care plan focused on meeting the person's health goals. It's critical that the facility staff are supposed to start planning for discharge from the day the resident is admitted.
How does a skilled nursing facility start planning for discharge on behalf of a person who has just been admitted?
This is done by a document called a care plan. This is a written document that details an individual's care needs and directs what staff is to do to meet those needs. For a skilled stay, the primary goal of the care plan is to get the person ready for discharge.
How does the care plan get developed?
It should be developed by a team consisting of various skilled nursing facility staff members and the resident, as well as anyone the resident wants as a representative. The leader of this team is a registered nurse called the Resident Care Manager, or RCM. Residents and their families should ask who their RCM is early in the nursing home stay and talk to the RCM about what the individual wants to get out of his or her time in the nursing home.
Are there other key staff members in a nursing facility that we need to know about?
Yes. Another important player in the skilled nursing facility is the Social Services Director, or SSD. This is the staff person who is in charge of making sure all the equipment and services are lined up that the individual needs to be able to manage at home.
Okay, so how does the Office of the Long-Term Care Ombudsman help when someone is staying in a skilled nursing facility?
We are here to ensure their rights are upheld. So we answer calls from the public, residents, staff, family members, etc. when an issue pops up during a skilled stay. Our job is to work on behalf of the residents to ensure their needs are met. The most common calls we get to our office is that a parent or spouse is not ready to leave the facility. Our first question as Ombudsman is, did the person receive a notice? Facility will often say, you're being discharged, and families and residents feel like there is no time to look for a new placement. You went from having potentially weeks to having 48 hours. 48 hours before discharge, Medicare will send you a notice that your benefit to skilled care is ending. This may come from Medicare, or if you have a Medicare Advantage plan, it would come from your health plan. This notice is called the Notice of Medicare Non-Coverage, or NOMNC, NOMNC. This doesn't necessarily mean your family member has to leave the facility. It just impacts who is going to pay for that care and the remainder of the stay. The written notice has to go to the resident. If a family member isn't there or is out of the area oftentimes, it's likely they haven't seen the notice. The NOMNC is issued when the facility believes they will no longer be able to bill your insurance for skilled care in 48 hours. If you are assisting a loved one at the nursing home, make sure you are in regular contact with the Social Services Director and ask that they also alert you when the NOMNC is issued. Issuance of the NOMNC isn't personal. That is, it's not the facility telling you or your loved one you are no longer welcome. The NOMNC is about whether you meet the Specialized Skilled Nursing Facility benefit. That is what Medicare pays for.
If someone initiates an appeal, can the person stay at the facility?
Yes, during the process of the appeal, Medicare will still cover the stay until the decision is rendered, but the facility may stop therapy during that time. Appealing the NOMNC is easy, and it's by phone.
When should a resident appeal the decision?
If you think you need more skilled care, you should appeal NOMNC right away. The appeal is quick and can be done by phone. You'll explain to the Medicare representative why you believe you need more skilled care. Remember, while you may not need skilled care that Medicare pays for, you may still need long-term care. Long-term care is paid for privately through one's income or savings, or through the state's Long-Term Care Medicaid program for those that do not have resources. This requires a separate application and approval process.
What happens if the appeal isn't successful?
If the resident still needs care, you can have them stay at the skilled nursing facility. However, and this part is really important, they will likely be changing from skilled care to intermediate or custodial care, and this is where payment comes in. Your loved one will have to pay privately with income, savings, etc. Apply for Medicaid, or if they are one of the few that has long-term care insurance policy, they may cover a continued stay.
What is the cost of staying in the skilled nursing facility?
A nursing facility is the most expensive option for long-term care, approximately $300 or more per day, or over $10,000 per month. Since most people can't afford to pay that much at all, or for very long, it's important to know your options for other types of facilities and or home care options from the time you enter the skilled facility.
If the resident is ready to leave the skilled facility but still needs long-term care, what do you recommend they do at this point?
There are options for long-term care in Oregon, ranging from assisted living and adult foster homes to in-home care. We know that most people prefer to be in their own home with support brought in. The Aging and Disability Resource Connection is a great starting point. Medicare can get complicated very quickly. Anyone who wants to know even more about Medicare, including the Medicare Skilled Care benefit, should get advice from a Medicare expert. In Oregon, one great Medicare expert is called SHEBA.
What is SHEBA?
SHEBA stands for Senior Health Insurance Benefits Assistance. They are a program here in Oregon that specializes in providing free information about Medicare. Another important resource to know about is the Senior Medicare Patrol program. Medicare loses an estimated $60 billion each year due to fraud, errors, and abuse. Every day, issues related to these concerning matters affect people across the country, often costing them money, time, and well-being. Medicare-related errors contribute to this annual loss, even though errors can be honest healthcare billing mistakes. However, a pattern of errors committed by a physician or provider could be considered a red flag of potential fraud or abuse if not corrected. If you feel there is anything off during your skilled stay, it's important to reach out, such as being charged for services that aren't being provided. please report this to Oregon's Senior Medicare Patrol hotline at 1-855-673-2372. We are here to ensure your rights are upheld when you're in any of the licensed long-term care facilities. So if you feel something isn't right, please call us to have our team walk through your case and get you the help you need. For questions about your rights or care in a nursing facility, including questions about discharge and the NOMNC, call LTCO at 800-522-2602. For questions about Medicaid and funding LTC, call 855-673-2372. To report suspicious billing or other concerns about Medicare fraud, call the Senior Medicare Patrol at 877-808-2468 or ask about it through the ADRC hotline above.